What happens if you lose eligibility for Medicare and Medicaid programs? Have you ever wondered what happens if you lose eligibility for Medicare or Medicaid? Losing eligibility can have significant consequences for your healthcare coverage and financial situation. If you lose eligibility for these programs, you will generally lose access to the health insurance benefits they provide. This can make it much harder for you to afford and access necessary medical care. For Medicare, which mainly covers adults aged 65 and older and certain younger individuals with disabilities, losing eligibility is not common. However, it can happen under specific circumstances. For example, if you fail to pay premiums for certain parts of Medicare, or if there are changes in your immigration status, you may lose your coverage. If this happens, you will need to find alternative health insurance. This might include getting coverage through an employer, the Affordable Care Act marketplace, or private insurance plans. Unfortunately, these alternatives can often be more expensive and may offer less comprehensive coverage than Medicare. On the other hand, losing eligibility for Medicaid is more frequent and can occur for various reasons. Medicaid is a joint federal and state program designed for low-income individuals, including children, adults, seniors, and people with disabilities. Changes in your income or assets can lead to losing eligibility. Additionally, some states have introduced new work requirements that may affect your eligibility. If you lose Medicaid, you will lose coverage for a wide range of health services. This includes hospital care, doctor visits, prescription drugs, and long-term care services like nursing home stays, which Medicare does not typically cover. The impact of losing Medicaid coverage can be severe. Individuals may face high out-of-pocket medical costs, particularly for nursing home care, which can cost nearly $11,000 per month. This financial burden can lead to significant medical debt, especially for seniors who rely on Medicaid for long-term care. Recent policy changes are projected to cause millions of people to lose Medicaid coverage. By the year 2034, estimates suggest that over 10 million more Americans could be uninsured. Those who lose Medicaid often do not qualify for premium tax credits to help purchase plans through the Affordable Care Act marketplace. This limits their options for affordable health coverage. For individuals who are dually eligible for both Medicare and Medicaid, losing Medicaid can mean losing assistance with Medicare premiums and cost-sharing. This can increase their financial burden and reduce their access to necessary healthcare services. In summary, losing eligibility for either Medicare or Medicaid typically results in a loss of health coverage, increased financial risk from medical expenses, and reduced access to essential health services. If you find yourself in this situation, it is crucial to explore alternative insurance options as soon as possible. Seeking assistance from state Medicaid offices or health insurance navigators can help you understand your options and avoid gaps in coverage.